The pandemic continues. Renowned experts say they're starting to notice a shift in patients' emotions regarding the coronavirus. Marisol Bragg has the story.
When the coronavirus shutdowns began, mental health experts at Renown say some of their patients express the feelings of loneliness and depression. But as the state continues to reopen, some of those emotions have subsided.
We're certainly starting to see that decline in that sense of loneliness as the phased plan has been implemented and people have the ability to get out.
Dr. Cord says they're finding that younger generations are eager to get out and are less concerned about the virus. But older adults at higher risk are taking a more reserved approach and staying indoors, so they may still be feeling detached.
That vulnerable population, that kind of 65 and older group, still really have to mitigate their exposure, so they're not doing as much.
Cord says he encourages anyone who's feeling disconnected to make emotional connections with others, engage in social interactions, maybe find a hobby and get some fresh air. All of which he says you should be doing with state regulations and safety precautions in mind. And in terms of getting back to normal, Cord says we're moving in a new phase in relation to mental health.
Now we're starting to move more towards the kind of healthy part. How do we stay healthy as we move forward? How do you get some balance back into your life?
But if you are still experiencing any negative emotions, Cord says don't be afraid to seek help.
If you're really starting to struggle and your constant thoughts are, I'm worried about getting the virus, or I'm worried, or I'm getting more depressed, I don't feel like I have any energy, or, worst case scenario, you're starting to have thoughts about suicide, please reach out.
We've set up a link on our website and 2 News app with resources. Covering the story, Marisol Bragg, 2 News.